Assalamualaikum. Another clinical station, abdomen, and here the scenario is glycogen storage disease. So clinical findings may be pallor, doll-like face, small for age, and distended abdomen. And there in the hand or any other of the skin, there may be bluish present. And in abdomen there is liver is enlarged and renomegaly is present, bilateral renomegaly is present. The diagnosis glycogen storage disease. What could be the differential diagnosis? It could be the because there is enlarged liver, it may be hepatoblastoma, congenital hepatic fibrosis. It may be due to enlargement of kidney, polycystic kidney disease we can consider. So to complete my examination, I want to do the anthropometry, vitals, uh, examination of the lymph node, inguinal hernia, genitalia, perianal region. I want to see the edema and want to do the developmental assessment and neurological assessment of this baby. So what could be the investigation? Diagnostic investigation, skin fibroblast enzyme assay, glucose 6-phosphate dehydrogenase, glucose 6 phosphatase activity, and liver biopsy to check the glycogen storage level after consultation, and supportive investigation and random blood sugar, peripheral there may be low, full blood count, thrombocytopenia in case of one and 1A defect and 1B defect, there may be neutropenia, and there may be increased uric acid, increased triglyceride level, and also ultrasonography of abdomen to see the organ, and there may be ascites, and in echocardiography for cardiomyopathy may be associated with this, and a renal function test, genetic test. And then how will you manage this child? Management for through the multidisciplinary team and team member, pediatrician, metabolic team, cardiologist, nephrologist, hepatologist, and rheumatologist if necessary, lies with skin genetist, dietitian, and support group and advice. Here the management starts with the frequent feeding. If the child is less, the goal is to maintain normal blood glucose level. Energistic infusion of glucose in infant and children more than under the age of 2 years, and dietary change including whenever the child is more than 2 years. So small frequent carbohydrate feeding and give throughout the day. They may include uncooked cornstarch. Uncooked cornstarch provides slow release form of glucose, and elimination of the food that contains high in fructose and lactose, and allopurinol to prevent gout and kidney stone, and enzyme replacement therapy, especially it is effective from pumping and liver transplantation. And we will give advice for frequent feeding to prevent hypoglycemia, avoid the crowded place to prevent infection, avoid trauma, and inform parents about easy brushing, and for frequent follow, we will keep the patient in for frequent follow-up for cardiomyopathy, and there is chance of development of hepatoma. And causes of anemia in glycogen storage disease, anemia of chronic disease, too much starch and no other food element, bone marrow affection. And the complication of this glycogen storage disease: growth failure, renal failure, liver failure, heart failure, osteopenia, renal stone, gout. And there is 4 types actually 5 types of these glycogen storage disease, and this is type 1 is von Guericke, type 2 is Pompe, having a giant QRS, cardiac involvement, and type 3 is Cori, like the von Guericke plus myopathy is present, and type 4 is Anderson, and type 5 is Mercadal. And here the Mercadal, there is muscle cramp and myoglobinuria on exercise, and all will be the submental. And causes of liver enlargement plus renal enlargement. This is the two differential diagnosis. One is glycogen storage disease, another is polycystic kidney disease. And there is in neonatal period, glycogen storage disease usually presents with hypoglycemia, lactic acidosis, convulsion, and more than 9 years they will also present with delayed puberty. Another is Gaucher disease. This is triad of huge spleen, bone pain, bone deformity, bone marrow affection, and or neurological symptoms. And general examination: short, disproportionate short stature, submental, pallor, no clubbing, no jaundice, no bruise, and there may be bone deformity. Bruise may be present, and there may be bone deformity. And in abdomen examination, huge splenomegaly. Investigation for Gaucher's enzyme assay in fibroblast culture after consultation with the consultant. Glucocerebrosidase deficiency, bone marrow aspiration, and Gaucher cell may be found there, and full blood count there may be pancytopenia, and liver function test, abdominal ultrasonography, Doppler bone profile, and complication: pathological fracture, portal hypertension, fits, nystagmus, ataxia. Causes of abdominal pain: splenic infarction. Treatment is enzyme replacement, bone marrow transplantation, splenectomy, and advice. And Gaucher cell are normal scavenger cell called macrophage. They become full of unprocessed glucocerebrosidase. Gaucher cell accumulate primarily in spleen, liver, bone marrow, causing organ inflammation and dysfunction. Thank you.